I want you to walk into your kitchen and open the cupboard where you keep your medicine. I want you to look at the rows of amber-colored plastic bottles. Maybe you see names like lisinopril, amlodipine, or losartan. These are the pills that keep you alive. They are the chemical guards that keep your blood pressure from exploding. You take them faithfully because you want to be here for your grandchildren, and you want to avoid the stroke that took your parents. But every time you swallow that pill, maybe you feel a little resentment. You worry about the side effects, the dry cough, the swollen ankles, the fatigue, the strain on your kidneys. You look at the monthly cost and wonder if there is a better way. You wonder if there is something nature designed that could work in harmony with your body rather than just suppressing symptoms. I am here to tell you that there is a solution that has been hiding in plain sight for thousands of years. It is not a new pharmaceutical discovery. It is not a rare herb found only on a single mountain in the Himalayas. It is a flower. A beautiful, vibrant, deep red flower that you can buy at almost any grocery store for pennies a serving. When brewed into a tea, this flower creates a ruby-red elixir that clinical studies have shown can lower blood pressure as effectively as some prescription medications. It is called hibiscus. In many parts of the world, it is known as sour tea or carcade. Today, we are going to explore the incredible science behind this drink. We are going to look at how it mimics the mechanism of ACE inhibitors, how it relaxes your stiffening arteries, and why cardiologists are quietly starting to recommend it to their patients. We will also cover the very specific way you need to brew it to get the medicinal effect, because simply dipping a tea bag for 10 seconds won't cut it, and the safety precautions you need to take regarding your teeth and your current medications. By the end of this video, you might just find that the most powerful tool in your heart health arsenal is not in your medicine cabinet, but in your teapot. To understand why this tea is a miracle for the aging cardiovascular system, we first have to understand why your blood pressure goes up as you get older. Imagine a garden hose. When the hose is new, the rubber is soft and flexible. If you turn on the water, the hose expands slightly to handle the flow. The pressure is low. But if you leave that hose out in the sun for 60 years, the rubber gets hard. It gets stiff. It cracks. Now, when you turn on the water, the hose cannot expand. The water has to force its way through a rigid tube. The pressure skyrockets. This is exactly what happens to your arteries. It is called arteriosclerosis. On top of this structural stiffness, there is a chemical problem. Your body produces an enzyme called ACE, angiotensin-converting enzyme. This enzyme is a villain for seniors. Its job is to constrict your blood vessels. It makes the tube tighter. When you have stiff arteries and this enzyme squeezing them tight, your heart has to pump with massive force to get blood to your brain and kidneys. This is hypertension. The drugs called ACE inhibitors, like lisinopril, work by chemically handcuffing this enzyme so your vessels can relax. Here is the breakthrough. Hibiscus tea contains natural compounds called anthocyanins and polyphenol that act as natural ACE inhibitors. They do the exact same job as the drug. They bind to that enzyme and stop it from constricting your blood vessels. But they do it without the synthetic side effects. A landmark study from Tufts University found that drinking 3 cups of hibiscus tea a day significantly lowered systolic blood pressure, the top number, in prehypertensive and mildly hypertensive adults. In some cases, the drop was equal to the effect of a standard dose of medication. This is not folklore, this is biochemistry. But the benefits go deeper than just blocking an enzyme. Hibiscus also stimulates the production of something called nitric oxide in your endothelium. The endothelium is the delicate inner lining of your blood vessels. Nitric oxide is a gas that acts as a signaling molecule. It tells the muscles around your arteries to relax and open up. It is the body's natural vasodilator. As we age, our production of nitric oxide plummets. This tea helps boost it back up. So, you are attacking the problem from 2 angles. You are stopping the constriction, ACE inhibition, and you are promoting relaxation, nitric oxide. It is a 1-2 punch against high blood pressure. Let's talk about the experience of drinking it, because medicine only works if you take it. Unlike bitter pills or nasty-tasting tinctures, hibiscus tea is delicious. It has a tart, tangy flavor, very similar to cranberry juice or pomegranate. It is refreshing. It is a deep, jewel-toned red color that looks beautiful in a glass. The color itself is the medicine. That red pigment comes from the anthocyanins, the same powerful antioxidants found in blueberries and cherries. These antioxidants scrub your arteries of inflammation. They prevent the bad LDL cholesterol from oxidizing and sticking to your vessel walls. So, while you are lowering your pressure, you are also cleaning the pipes. Now, we need to discuss the protocol. This is where most people get it wrong. If you buy a box of berry blend tea that has a tiny bit of hibiscus and a lot of artificial flavor, you will not get the results. You need pure Hibiscus sabdariffa. You can buy it in tea bags, but the best and cheapest way is to buy the dried flowers, calices, in bulk. You can find them in Mexican markets, labeled as Jamaica, or health food stores. A 1-pound bag costs very little and will last you for months. To make the medicinal brew, you need to treat it like an infusion. Step 1. Take 2 tablespoons of dried hibiscus flowers. Step 2. Place them in a pot with about 3 to 4 cups of water. Step 3. Bring it to a boil, then immediately turn off the heat. Step 4. This is the secret, let it steep. Do not rush it. Let it sit for at least 15 to 20 minutes. You want to extract every bit of those red polyphenol. The water should turn a dark, rich, almost purple red. Step 5. Strain out the flowers. You can drink this hot, like a comforting morning tea. Or, you can pour it over ice. In fact, iced hibiscus tea is incredibly popular in hot climates because it has a cooling effect on the body. It is the perfect replacement for the sugary iced tea or soda that so many seniors are addicted to. If you find it too tart, and it is sour, do not ruin it with white sugar. Sugar causes inflammation, which raises blood pressure. Sweeten it with a little stevia, monk fruit, or a small amount of honey. Or, add a cinnamon stick or a slice of ginger while it brews. Cinnamon and ginger are also heart healthy and add a warmth that balances the tartness. How much do you need to drink? The studies suggest that consistency is key. 1 cup every now and then is a nice treat, but it won't fix your hypertension. You need a therapeutic dose. That usually means 2 to 3 cups daily. Think of it as a prescription. 1 with breakfast, 1 with lunch, 1 in the afternoon. It creates a steady level of the active compounds in your bloodstream throughout the day. Now, we must have a serious conversation about safety. Just because it is natural does not mean it is harmless for everyone. There are specific precautions you must take. First, the double down effect. If you are already taking a high dose of blood pressure medication, and you suddenly start drinking 3 cups of hibiscus tea a day, your blood pressure might drop too low. This is called hypotension. You might get dizzy, faint, or fall. Falls are catastrophic for seniors. You must treat this tea with respect. If you decide to start this regimen, you need to monitor your blood pressure at home closely. Keep a log. If you see your numbers dropping consistently, take that log to your doctor. Say, look, my lifestyle changes are working. Can we lower my medication dose? This is the goal, to use the tea to eventually reduce your reliance on the pills, under medical supervision. Do not stop your pills cold turkey. Second, the diuretic effect. Hibiscus is a natural diuretic. It makes you urinate. It helps flush excess sodium and fluid out of your body, which helps lower blood pressure, similar to hydrochlorothiazide. However, if you are already taking a diuretic, water pill, this can dehydrate you or throw off your electrolytes. Also, purely for quality of life, do not drink your last cup right before bed. You do not want to be waking up 3 times a night to use the bathroom. Sleep is essential for heart health too. Finish your tea by 5 p.m. Third, the tooth enamel issue. Hibiscus is acidic. It has a pH similar to fruit juice. If you sip on it all day long, day after day, the acid can soften the enamel on your teeth. As we age, our gums recede and our teeth become more vulnerable. We want to protect them. The solution is simple: drink it with a straw. This bypasses the teeth. And after you finish your cup, swish your mouth with plain water to neutralize the acid. Do not brush your teeth immediately after drinking it, as the enamel is soft. Wait 30 minutes. Fourth, medication interactions. Hibiscus can affect how the liver processes certain drugs, including Tylenol, acetaminophen. It is generally safe, but if you have liver disease or are on a complex medication regimen, check with your pharmacist. Let's look at the other benefits that come along for the ride. While you are drinking this for your blood pressure, you are getting a bonus package of health benefits that are perfect for the 60-plus body. Cholesterol management. Studies have shown that hibiscus can lower triglycerides and LDL cholesterol while raising HDL, good, cholesterol. It helps balance the lipid profile. Weight management. There is some evidence that hibiscus extracts can inhibit the absorption of carbohydrates and starch. It might help with weight loss or preventing that creeping weight gain around the middle that plagues us after menopause or andropause. Liver health. Fatty liver disease is becoming an epidemic among seniors, even those who don't drink alcohol, due to our diets. The antioxidants in hibiscus protect the liver and help prevent fat accumulation. Immunity. It is packed with vitamin C. A strong immune system is your best defense against the flu and pneumonia. I want to address the psychological shift of the tea ritual. Taking a pill is a chore. It is a reminder that you are sick. It is a passive act. Brewing a pot of tea is an active act of self-care. It is a ritual. It takes time. It smells good. Holding the warm mug in your hands is soothing. Taking 10 minutes to sit and sip your medicine changes your relationship with your health. You are not just managing a disease, you are nourishing your body. This lowers cortisol, stress, which further helps lower blood pressure. It is a positive feedback loop. Compare the cost. A month's supply of blood pressure medication, depending on your insurance and the specific drug, can be expensive. A pound of dried hibiscus flowers costs maybe $15 and lasts for months. It is one of the most cost-effective health interventions available. It is democratic medicine. It is available to everyone. Let's debunk a common myth: tea has caffeine, so it raises blood pressure. Hibiscus is an herbal tea, tisane. It is not made from the tea plant, Camellia sinensis. It has zero caffeine. It will not keep you awake, unless you drink it too late and need to pee. It will not give you the jitters. It is a relaxant, not a stimulant. I want to share a story of a friend of mine. Let's call him Robert. Robert is 68. He was on 2 different blood pressure meds and still hovering around 140/90. He was frustrated. He hated the side effects. He started the hibiscus protocol, 2 cups a day, iced, with a little squeeze of lime. He committed to it. He bought a home blood pressure cuff. After 2 weeks, he didn't see much change. He almost quit. But he kept going. By week 6, he noticed his morning numbers were consistently 125/80. He felt lighter. He went to his doctor. The doctor was surprised. They cut one of his medications in half. 6 months later, he is maintaining healthy pressure with a lower dose of meds and his daily red drink. He feels empowered. He did that. The tea helped, but his commitment was the cure. This is what I want for you. I want you to have agency over your own numbers. Now, how to incorporate this into a busy life? You don't have to brew it fresh 3 times a day. That is too much work. Make a concentrate. On Sunday, brew a big pot with a high concentration of flowers. Make it strong. Strain it and put it in a pitcher in the fridge. Then, during the week, just pour a little concentrate into a glass and dilute it with water or sparkling water. It makes a fantastic mocktail. It feels fancy. It feels like a treat, not a treatment. There is a cultural history here that we should respect. This tea has been used by the pharaohs in Egypt. Carcade is the national drink of Egypt. It has been used in traditional Chinese medicine. It is used in the Caribbean, sorrel, for Christmas. We are just rediscovering what our ancestors knew, nature provides. But remember the sour factor. I cannot stress this enough. If you have a sensitive stomach or suffer from severe acid reflux, GERD, the acidity of hibiscus might bother you. If this happens, try drinking it with food rather than on an empty stomach. Or dilute it more. Listen to your body. If it causes heartburn, it might not be for you. But for most people, it is well tolerated. So, let's summarize the red tea action plan. Buy the flowers, look for dried organic hibiscus flowers, Hibiscus sabdariffa. Avoid sugary pre-mixed powders. The brew, 2 tablespoons flowers per 3 cups water. Steep 15 to 20 minutes. The dose, 2 to 3 cups daily. Consistency is everything. The monitor, check your BP regularly to ensure you don't drop too low if you are on meds. The protection, use a straw for your teeth. Rinse with water. The patience, give it 6 weeks to see the full effect. This isn't about rejecting modern medicine. If you are having a hypertensive crisis, you need a hospital, not a cup of tea. But for the long-term management of chronic high blood pressure, for the daily grind of keeping those numbers down, hibiscus is a powerful ally. It bridges the gap between diet and medication. Imagine sitting on your porch or in your living room. You have a glass of ruby red iced tea. It tastes tart and crisp. You take a sip. You know that with that sip, you are flooding your body with antioxidants. You are relaxing the walls of your arteries. You are boosting your nitric oxide. You are doing something good for yourself that costs almost nothing and gives you pleasure. That is the definition of sustainable health. It's not about suffering. It's not about deprivation. It's about finding the things that heal you and making them part of your life. So, next time you are at the store, walk past the soda aisle. Walk past the sugary juices. Go find the dried herbs. Find the hibiscus. Bring it home. Brew your first pot. Watch the water turn red. And drink to your heart's content, literally. Your heart, your brain, and your arteries are waiting for it. Thank you for listening. This information is simple, but it is transformative. Share it with your friends who are struggling with their numbers. Let's make tea time a health revolution. Stay safe, stay hydrated, and keep your pressure down.